What exactly is depression? Depression is the world's largest cause of disability. Nearly 10% of adults in the United States suffer from depression. However, because it is a mental disorder, it might be far more difficult to comprehend than, instance, high blood pressure or cholesterol. The distinction between having depression and simply feeling depressed is a common cause of misunderstanding. Almost everyone feels low from time to time. A low grade, a job loss, a fight, or even a rainy day can all trigger feelings of despair. Sometimes there isn't even a trigger. It just pops out of nowhere. Then things change, and those sorrowful sentiments fade away. However, clinical depression is not the same. It's a medical condition that won't go away just because you wish it would. It lasts for at least 2 weeks and greatly impairs one's capacity to work, play, or love. A depressed mood, loss of interest in activities you normally enjoy, changes in appetite, feelings of worthlessness or excessive guilt, sleeping too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurring suicidal thoughts are all indications of depression. According to psychiatric guidelines, you qualify for a diagnosis of depression if you experience at least 5 of these symptoms. It's not simply behavioral signs either. Depression manifests physically within the brain. First and foremost, there are visible alterations with the naked eye and X-ray vision. Smaller frontal lobes and hippocampal sizes are examples of this. Depression is associated with a few things on a smaller scale. Abnormal transmission or depletion of certain neurotransmitters, particularly serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow-wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and thyroid hormone deregulation. However, neuroscientists do not yet have a clear picture of what causes depression. It appears to be caused by a complicated interaction between genes and environment, but we don't have a diagnostic tool that can predict where or when it will appear. Because depression symptoms are intangible, it's difficult to tell someone appears to be fine, but is actually hurting. According to the National Institute of Mental Health, the average person suffering from a mental disease takes more than 10 years to seek help. However, there are highly effective treatments available. Medication and therapy work together to increase brain chemicals. In severe situations, electroconvulsive therapy, which is similar to a controlled seizure in the patient's brain, can be quite beneficial. Other intriguing treatments are also being researched. So, if you know someone who is depressed, kindly advise them to look into some of these possibilities. You may also volunteer to assist with specific chores, such as researching therapists in the area or compiling a list of questions to ask a doctor. These first steps may appear daunting to someone suffering from depression. If they feel guilty or humiliated, remind them that depression, like the flu or diabetes, is a medical disease. It's not a defect or a personality flaw, and they shouldn't expect themselves to just get over it any more than they could get over a twisted ankle. Avoid comparing it to times when you felt down if you haven't experienced depression yourself. When people compare what they're going through to typical, temporary sensations of grief, They may feel guilty for being in pain. Even openly discussing depression can be beneficial. For example, studies shows that questioning someone about suicidal thoughts lessens their likelihood of suicide. Open discussions about mental illnesses serve to reduce stigma and make it easier for people to seek care. Furthermore, the more patients who seek treatment, the more scientists will understand about depression, and the more effective the medicines will become. Subscribe to Reliever for more. And don't forget to press bell icon so you never miss an update.